is Dr. Swapna Athole. She is plastic and aesthetic surgeon from Pune. Hello, Dr. Swapna.
Hi, Akshata.
Dr. Swapna, today this topic is very trending about mommy makeover and how exactly is it affecting the people today is a different kind of viral topic. So I just want to know what exactly is this mommy makeover?
Yeah, so mummy makeover is a very interesting topic. Mummy makeover is a surgical procedure where we have to reverse all the changes which are happened because of pregnancy. So in women, pregnancy causes a lot of hormonal changes, mainly the parts which are breast, abdomen, thighs. Sometimes it's a pigmentation over the face and very thinning of hair in pregnancy or post-lactational period. So this mummy makeover is a procedure where we reverse all these changes happened because of pregnancy and lactation. So this is a aesthetic procedure which is done mainly for post pregnancy reversal of changes.
Okay, and what all procedures are combined in this?
So what we address, usually females come to us for sagging of breast, laxity of breast tissue, breasts are sagging down after lactation, then lower abdominal wall is having a stria and loose abdominal folds. There's a lot of fat deposition around the buttock and thigh area, and sometimes there is pigmentation over the face, and sometimes there is thinning of hair. So women come with all these problems, and then we have to address all these problems according to the patient's criteria, according to what they want to correct it.
Okay, and when do you think is the right time for a woman to opt for this kind of procedures?
Okay, so mummy makeover, usually patients come when they are done with their lactational period. So we always advise to wait for a year or two after delivery, so that all post-delivery hormonal changes, they will revert back the tissues to their normal position, and the remaining part, which is like sagging of breast after breastfeeding, or lower abdominal fold, or sometimes C-section scar, or sometimes there is a rectal divarication where there is a gap between your rectus muscle, that can be corrected, and your abdomen and breast can be tightened up to the pre-pregnancy status. This is the procedure mainly included in mummy makeover. And most of the time it is combined with liposuction, as unnecessary fat depositions we take out through this procedure. And most of the time we offer treatment for facial pigmentation and hair thinning too, which is completely non-surgical, can be combined with these procedures.
Okay, so it all sounds fancy, to be very honest, but do you think it is very common in India for newly mommies to just opt for this procedure, and do you think it is safe at the most?
It is very safe, done by a qualified plastic surgeon. So whether it is common in India, nowadays it is getting more and more common as people are getting educated. Most of the women are working women, so they want to have normal lifestyle and normal clothing post delivery. So many women are coming forward to asking for this mummy makeover aesthetic procedures. So and it is very safe. It is most of the breast and abdomen procedures are done under general anesthesia, which is nowadays very safe. We do it at corporate hospitals, and it's anesthesia wise very safe procedure. So yes, it is safe.
So that is really nice to hear, getting such a nice makeover for all the mommies, and it is safe. It is really relief when mommies always would hear about it. But what do you think would be a recovery time after this procedure being done?
So most of the time we combine breast and abdominal procedures together. So recovery time for this breast and abdomen procedures is, admission time will be around 2 days in the hospital, and after that 1 week of rest at home. And yes, after 1 week or 10 days, patients can join back to their normal working schedule for sure.
That is really nice listening from you, Dr. Swapna. It was really lovely to have a conversation one-to-one with you. We really thank you for such a nice information.
Thank you, Akshata. Thank you.